My motivation for applying for this malaria roster stems from the fact that I was born and raised in a malaria endemic country, where I've had first-hand experience of the devastating effect of malaria growing up as a child. Therefore, my involvement in this roster fosters a sense of social responsibility and personal fulfillment, as it will enable me contribute to lessening the effects of a disease that I experienced growing up as a child on children today and children in the future, which will also improve public health outcomes. It will also enable me to contribute to a global initiative to combat a disease that disproportionately affects the vulnerable populations. By participating in this roster, I will bring to bear my knowledge and expertise in the implementation of immunization and vaccine programs that will contribute to lessening the effect of this disease on vulnerable populations. Finally, my individual contribution to the collective effort of malaria eradication will bring relief and save lives of many in communities globally. I intend to support the roster by contributing to the provision of guidance, coordination, and communication with WHO regional focal points. By leveraging on my knowledge and skills in the following areas: I have a strong public health background with expertise in vaccine-preventable diseases, immunization, and epidemiology, with an understanding of broader context of global health issues and the principles of disease prevention and control. I have in-depth knowledge on malaria, including its epidemiology, transmission dynamics, and prevention and control strategies. I am very experienced in the planning, implementation, and evaluation of vaccine programs in countries such as Ghana, Afghanistan, and Ethiopia. I have experience in data analysis with strong analytical and problem-solving skills, and these are essential for identifying challenges and developing evidence-based solutions. I have the ability to collaborate effectively with government agencies, non-governmental organizations, and community groups. I am very sensitive to cultural, social, and political issues, and this has guided me in the delivery of essential interventions to local needs and overcoming barriers to vaccine uptake and acceptance. By possessing these experiences and knowledge, I will make a meaningful contribution in the provision of technical guidance, coordination, and communication with WHO country regional focal points related to malaria vaccine introduction, which will ultimately help in the advancement of global efforts to combat malaria and improve public health outcomes. Currently, malaria presents numerous challenges to the WHO. Firstly, despite recent achievements made, malaria remains a major cause of mortality globally, especially in sub-Saharan Africa. The emergence of drug-resistant malaria parasites threatens the effectiveness of current treatment methods. Also, although malaria vaccine is available, it is limited by its efficacy and widely accessibility. Aside this, insecticide-treated bed nets and indoor residual spraying, which are the most effective vector control measures, are challenged with insecticide resistance and logistical issues in reaching remote populations. In addition, socio-cultural factors such as poverty and limited access to health are all factors that contribute to persistence of malaria in many countries. I therefore suggest that WHO enhance research and development to develop more efficacious malaria vaccines, innovative treatment options, including those targeting drug-resistant strains and vector-resistant and insecticide-resistant vectors. I also suggest the implementation of integrated vector management strategies aimed at controlling mosquitoes and reducing transmission, strengthening surveillance and responses to detect and contain outbreaks, enhancing collaboration with NGOs to increase access to malaria control interventions, addressing socio-cultural factors, and also mobilizing resources to support malaria eradication program. By this, I think WHO will achieve its main purpose. Thank you.